Hello everyone, my name is Leng I am a clinical psychologist. Today I would like to share some information about depression, or better known as major depressive disorder. Over the years, I worked with many patients and clients with this diagnosis. Some of them are able to lift their moods very fast because of their understanding of this information that I'm going to share. So I will focus more on the formulation, or there are many causes of depression, but sometimes some formulation or some symptoms may be similar. I'm just summarizing what I see or summarizing my experience, and if this understanding helps you, then share this video with your friends or family or with anyone that can benefit from it. Okay, let's get into the topic. All right, so first of all, we need to understand what sort of worsen or what sort of exacerbate depression, right? So we know that we sort of know that depression is a pathological mood. You lost interest in all of the activities. You don't feel, or you're unable to feel pleasure. You're experiencing low mood all the time. You feel tired all the time, right? You withdrawn from socializing. So that's sort of some of the symptoms of depression. So, but what I want to share with you is that what worsens the depression. So when people are depressed, research shows that they engage more in REM sleep, rapid eye movement sleep. Do you know why is that? Because people that are depressed dream more, and because they dream more, they actually feel more tired when they wake up during the day. The reason for that is that when they dream more, they have less deep sleep, and when they have less deep sleep, they don't feel energized, they feel fatigued, and that causes them to want to sleep more. But when they sleep more, they dream more and they feel more tired, and usually those dreams are disturbing dreams, or like dreams that are not pleasant. Okay, so we sort of start from sleep, and we will explain like why the word rumination is here, right? So what we know is that people that ruminate more during the day will dream more during the night. And what rumination is a repetitive negative thinking behavior, right? It's a behavior that people in depression dwell in. So basically, people that dwell on negative thoughts, right? So for example, when I got scolded by my supervisor, I think to myself, why am I so stupid? I am scolded by my supervisor, I'm scolded by my superior. Why didn't I do that better? Shouldn't, why am I so useless? Why is life so suffering for me? Why is it so unfair for me? And you feel, every time you think about these thoughts, the worse you feel, the more sadness you feel, the more depressed you feel. And if you continue to dwell on this thought, you go down on the downward spiral, right? So you something unfortunate happened to you, but you keep dwelling on it, and that creates rumination. And when you dwell in that rumination, there's a lot of emotions that are charged up, and those emotions don't get discharged, because if you dwell on it, it's actually magnifying it. All right, So where does all these emotions go? They go into your dreams. So when you're sleeping at night, dreams are there symbolically to help you discharge or excrete all these negative emotions. So the more negative emotions, the more sadness, depressed mood you accumulate during your day, the more dreams you will have during the night. And when that happens, your mind don't get rested. You feel fatigued, you feel sleepy, right? And then your sleep gets disrupted and you feel like you don't want to wake up during the day, okay? And what that causes is actually a vicious cycle. The more you sleep, the more you ruminate, because the next day you think, why am I so tired? Why don't I feel energized? Why life is so difficult for me? I can't even get up. Why am I so useless, right? And when you start to think like that, then you sort of, it becomes a vicious cycle. And then people, how do I avoid all this? Okay, sleep on it, do nothing. So that's one of the common misconceptions that people do, people think that depression is a biological mental illness, biological sickness, and I think that's a mistake in conceptualization. Okay, so what do I mean by that? So like all sickness, if you have a cold, a flu, or fever, what do you usually do? You rest, you sleep, you recover when you rest enough. But the problem is with depression, the more you sleep, the worse it becomes. Sometimes people even quit their jobs or quit their studying, thinking that will help them to overcome depression, take some time off to rest. But what they don't understand is when they have more time, they use all this time to ruminate, to dwell on their failures, and that can actually worsen the symptoms, right? And some people, they use sleep as a coping mechanism, which means that if I sleep, that means that I don't have to face my suffering, I don't have to face my pain, I don't have to face reality, right? Not knowing that actually makes you more fatigued, makes you sort of like a zombie, psychomotor retardation, and it gets you deeper in the hole. Okay, when that sort of happen, you will have low self-worth, and when you start to have low self-worth, means that you feel like garbage, you feel like you devalue yourself, you feel like not worth anything. Suicide ideation and suicide thoughts start to arise, right? So another important concept by Martin Seligman is the concept of learned helplessness, right? So learned helplessness is sort of like you're trapped. You learn that you are helpless. You can't help yourself, right? So to understand this concept, you need to read Martin Seligman's experiment. I think he electrocuted some dogs, right? And in one group, there's a button to stop that electrocution. In another group, there's no button. And when they put the dog into a new environment, they want to see if they electrocute the grid or the floor of the cage, they want to see which dog will jump over to another place, right? So what they found out is that the dogs that were not given the button to stop the electrocution, The dogs that were not given a choice or autonomy, they just learn to accept the pain. They learn that there's nothing they can do when they feel pain or when they are tortured. And then people with trauma, people with depression sort of believe that. They learn that there's nothing they can do about their depression. That's why it's so hard to treat depression, because they already given up. They learn that whatever they do means nothing. They learn that whatever they do, they can't get out of it, right? Not even if there's an opportunity to get out, they can't, because they learn from experience. They have failed so many times. That means that they are going to fail again, right? So this is a very difficult situation. Okay, so what do we need to do? The treatment is easy, right? But it's just hard to implement it. You need a therapist who is supportive, who the clients or the patient feels safe enough to guide him or her. When he trusts you, and these are some of the things that you can do. So the first thing is to find out how to reduce that rumination. There are many psychological techniques to do this. Cognitive behavior therapy is one of them. Mindfulness-based therapy is one of them. As simple as like finding the triggers of rumination and stopping it is one of them, right? So for example, if someone ruminates a lot when they're alone, then the strategy will be to get them to fill their time up with friends and family. So when they are with people, they dwell less in their thoughts, right? Another thing that you can do to help yourself with depression is that get out of bed, exercise, do something. That's behavior activation. Engage in activities rather than your thoughts. But this is hard to do when people are stuck in that loop, in that vicious cycle, when everything feels like failure, everything feels hopeless. It's hard to engage in pleasurable activity, or it's hard to force oneself to move, right? So in that case, sometimes medication can help to lift that mood a little bit, so that you can do this exercise, you can move a little bit more. And when you get your life into a structure, when you start to engage in activity, then you can slowly taper down the medication. Okay, if not you will still be dependent on medication, and some people need that. Right, so that's a very brief summary of what you can do if you are depressed, right? Hope that you can share this video with your friends and family, so that they can have a better understanding of what depression is. And if you would like more help, if you need more help, please don't hesitate to contact a psychiatrist or a clinical psychologist. Okay, sometimes talking it with someone professional, sorting out your thoughts and emotions, and having some guidance in doing the strategies can help tremendously, right? You don't have to do this alone. Okay, that's all I want to say for today. Thank you for paying attention.